CASPER, that stands for Computer Assessed Sampling of Personal Characteristics. It is a computer-based test where you are shown some scenarios. After the video, you're given a couple of open-ended questions for how to respond. How would you react to this individual scenario that you just watched? And so what's the reason why are medical schools sort of doing these situational judgment tests? What's kind of led to this? This test really is more about the social situational intelligence. Can I read a room? Can I understand what's happening? Can I recognize the emotional aspects of what's going on? That leads to what type of doctor am I likely to be? What type of bedside manner am I going to show when I'm dealing with a patient who's in the midst of, some type of crisis or health situation? Am I going to be able to kind of, understand, show empathy, relate to them as a patient and not just a symptom that I'm treating?
When you're looking for the official website, this is actually it right here. So that acuityinsights.app/Casper is going to bring you to, what is the Casper exam?
If you go to the website, there's some just basic information about what is CASPER. You can kind of, read about the different, the processes. What is it assessing you for? So you kind of see there on the screen, they're looking at your communication, your empathy, the ethics that you demonstrate. Can you solve a problem? Are you professional in the way that you interact with people? There's a link right there where you can see test cycle FAQs. It tells you the dates and fees at the top. So there's all the information that you need. You can kind of see, there are many, many opportunities for you to schedule this test. And so it's just like the MCAT, it tells you, the timeline, when to do it, when you're going to take the test. And so you would go on this website here, you would reserve at the bottom right there. There's a button, reserve your test. So you would pick your test date and it gives you all the information. So it's $85. Your results from CASPER are going to be sent to 7 programs. That $85 fee covers that. If you want to apply to more than 7, then you're going to pay $16 for each additional program over this. So starting with program number 8, you're paying $16 for each additional school that you wanted to be sent. Now, the CASPER it's used for a lot of different professions. It isn't just for medical. A lot of other professions do it. So when you're registering, you are going to select the program that you're applying for. And so you're going to pick allopathic, osteopathic, medical schools, dentistry, whatever professional school you're applying to. Once you do that, it will give you the list of schools that are using the CASPER or requiring or recommending the CASPER. And then you would pick up to 7 schools at this point for that $85. And those schools that you select right here will automatically receive the results of your CASPER exam once your scores are available. It says that it takes about 2 weeks. So there's a 2-week time period after you take the exam when the score is received at the professional school. And so there's a whole list here of frequently asked questions. What's the test day like? When you take the test, the only thing that you receive is the quartile that you tested into. So the higher the quartile, the 75 to 100 percentile is the best result that you want. But you don't know if you scored 80 or you scored, 75. You're just going to know that you're in that particular quartile where your score falls. So, an applicant who scored in the 4th percentile would be higher than the people in the 1st, 2nd, and 3rd, but you don't know where you landed within the 4th percentile. Yeah, so that's a little confusing and a little, well, we'll just leave that where that is. They don't give you an actual score. You just know what percentile you scored in. And so on the website here, there are some examples of some of the scenarios that you look at. The test lasts from 90 to 110 minutes, depending on whether you take breaks or not. You have the option for 2 10-minute breaks, so that's where the additional time comes in. But during the test, you're shown 14 scenarios, I believe, over that time period. And after the test, you have 3 questions about the video. So you can go here and watch the video. This first one, this is co-workers sitting around a table, and you're you're there, you're one of the coworkers, and this gentleman is sort of debating the idea of should he take, like, his wife's about to have a baby, and she wants him to take paternity leave, and he's sort of trying to decide, is that a good decision? If I take the paternity leave, he's going to miss an opportunity for a promotion, and he's trying to decide what's better in the long run for my family. Do I want to be there with my wife and my baby, but in the long run, is that going to be a negative for my career path? And so they're gonna, give you a chance. What do you think? What do you think this guy should do? And so there's the example of the questions. Would you recommend that he take paternity leave, and why or why not? What strategies would you offer to help him make a decision? And then maintaining work and life balance can be challenging. What do you think people why do you think people struggle with this? So you've got 5 minutes to answer all three of these questions, right? And so obviously that's not a lot of time, and you're not going to have a whole lot of time to rehearse or whatever. And actually, the way that the test is scored, you just it's kind of like a free flow thinking. You're just trying to put down every thought that you had, everything that you would take into consideration when you're trying to recommend should he take paternity leave or not. You're basically just throwing out every kind of thing that comes into your mind. You're not scored on grammar or punctuation or spelling. It's just, the ideology, why you're giving the advice that you're giving. In the advice sections, it says not to worry if you run out of time, because, they're not necessarily looking for a polished, put together essay that you would turn in an English class. They're just looking at your thoughts, your opinions about this, and how you sort of came to what you're giving. Why are you giving this advice? What is the advice based off of? So that's the first one. The second one is about a clerk in a retail store. She's a brand new employee. The store policy is they only give refunds if the person has the receipt. And this guy's coming in. He's trying to get his money back for this toy that he bought for his kid. He doesn't have the receipt, and he says, I'm desperate. I've got to get this money back because my child is very ill, and we have to pay for medicine and the doctor's bill, and this, the only way I can do it is if you give me my money back. And so, again, as a manager, would you give the money back to the customer? Why or why not? So that kind of gives you an idea of what you're going to see. 14 of these different little scenarios like that during this hour and a half, basically. And you're just going to put down your flow of thoughts based on how you would respond in this situation. So it's interactive. It's sort of there's nothing that you can study for in terms of anticipating what the scenario is going to be about. It obviously has nothing to do with a doctor-patient interaction, although some of them may. But it's really more about how do you scan a room? How do you assess what's going on? How do you respond? And why would you respond the way that you do in these situations?
Yeah, I just want to mention too, you can only take this test one time per cycle. So it's not like the MCAT that allows 3 times. So you got to really be ready to take it when you have it on there. And just to provide clarity to what Mr. Bone was saying, you're going to see there's all different sections. You will be typing end video. So they have 4 different ways they do it, so there's 2 sections, and they show a video where you're presented with a word based and you do a video, and then they do video and you do video. And then the second one, kind of vice versa, you type your answer, and you have word based and video based. So they can show you words, or they can show you video, and then you can reply in video or you can reply in words. And there's kind of 4 different ways.
You'll do both on the test. You'll do some video, you'll do some typing. But it's the same kind of concept where you basically have 5 minutes and you don't really have, they're not looking necessarily for a cohesive, structured speech. It's just, what is your response to what's going on?
Right. And so I think to kind of emphasize Mr. Bone is saying, if you didn't catch it, is there's no right answer to these ones. His whole point is that, they're looking, are you an ethical, good person? And maybe you went with, you decided to do the first idea, and then someone else has a different idea, but you both could get a good score. Or you could do the same thing as somebody else, but you could get a bad score if you did it in an unethical way, or you notice that word empathy was on there in an unempathetic way. And so just keep that in mind. I know, as Mr. Bowen said, you could prepare for the exam, meaning see some practice questions, but at the end of the day, it's not like math where there's a right answer. It's more about being a good person, it's a situational judgment, making a good judgment on the situation. And there's going to be brand new questions you probably never thought of or seen. So you just need to prepare on, as he said, not working on the grammar, but working on empathetic responses, how to think strategically, that sort of thing.
The preview is a test that was developed specifically by the AAMC for medical schools.
You do need to pay attention to what schools you're applying to, because you may not have to take these at all. It might be that, some of the schools you're applying to don't require it, or it might be that, you have to take both of them because different school lists. So as I said, if you're going to be applying to, some of our closest DO schools like William Carey, or, one up in Arkansas College of Health, or a lot of the Texas schools, A&M, see Tulane's on here. Any of those, you're going to have to do the CASPER test. So that's just going to be on there. Be ready for that. If you're applying to Texas, you're applying to East Tennessee, you're applying to William Carey. So just be aware of that. Look into that. These can change by the year. And as Mr. Bowe mentioned, osteopathic, allopathic, all those things.
In the admissions office at the school where you're applying, they will let you know if they require it, or they'll say that they recommend it. So when you're, looking at schools that you're anticipating applying to, that information will be on their website at their admissions office, so you can kind of know, if I want to apply to Texas A&M, I'm going to have to take the CASPER exam.
The CASPER was the first test like this, at least for medical school admissions. And so that's why we brought it up first. It has a bigger list of schools that require it. And so, no, it's third party. And what we mean by that is it's not part of AAMC. The CASPER is not part of the AMCAS. So it is going to be required by schools. Some schools won't review you until they have it from you, but it is a separate thing. You need to make a whole new account with them, log in, schedule it. You take it online at your house, but you're proctored. And then also we're talking about the non-third party one. And so anyway, we have AAMC. If you guys aren't aware of AAMC, you should be here if you're interested in MD medical schools outside of Texas public schools. So if you're interested in Texas public schools, you fill out a TMD SAS. If you're interested in osteopathic med schools, a COMIS, a lot of those are a lot of CASPER ones. And then the AMC is for the 49 states, and private Texas schools. So our two LSU schools are part of AMC. And this is where you sign up for the MCAT. This is where AMC.org, where fill out the AMCAS, and there you'll also find what's called the preview exam. So same idea as the CASPER. Everything Mr. Bowen just said about what they're looking for is the same idea, looking for those soft skills as a doctor. It is an additional test on top of the MCAT, but there's only a certain amount of list of schools that require it or recommend it, and we'll go through that. But I did just want to say here, this is not something that you need to be, if you're a freshman, sophomore, you don't need to be freaking out about this. You could definitely be focused on the MCAT. But if you're a junior this year, know that you need to be taking this next summer if one of the schools you're applying to requires it. It's a little different than the CASPER, right? What we said about the CASPER, where there's no right answer, that's different with the preview. So there is a right answer here. And so we want to talk about how they did that, but this is not something you need to send off to schools because it's going to be part of your AAMC account. So you spend the $100, it uploads straight to there. You're going to get a score between 1 and 9, as obviously 1 being the worst, 9 being the best, and everything in between. Now this test is newer, like we said. So they piloted it 2 cycles ago. So 3 years ago, they piloted it. It was called the SJT, the situational judgment test. It was very brand new. They're just looking into it. Last year and this cycle, they've renamed it to the preview exam. And so, just be aware that preview, it's a confusing name, if we're being honest, because it sounds like it's like a sample test. But the preview is actually a required test to take by some medical schools, and we'll show you that list. So don't be confused. This isn't some sort of, intro test. This is the test is called the preview. Now, I do want to say on the finances part, if you qualify for fee assistance, you get this test free. Preview, you also typically get the CASPER free as well. So do want to just check into that, see if you qualify. But the first thing I just want to talk about is the school list. I think that it's probably going to be important to you guys. So if you go to AMC's website and you find this preview page they have here, you can probably find it through Google. They have the participating schools. Now it's almost a guarantee that this will change by next spring for next summer. So if you're watching this podcast, this is September 2023, go back to the website. It's going to be different then, but this is how we look at it, right? We can see these programs, if you're applying to any of these, you have to take the preview. You got to pay the $100. You have to take this at home. You got to sign up for it, and you get that score. And just so you know, every school in AMC will be able to see it, but only these schools are requiring it. So, as I look here, the closest ones are, Mercer and SLU. Those two you may be applying to, maybe, one of the UC schools, maybe UMass, but just check that out. That's going to change. But if you scroll down a little bit further, you see our very own LSU New Orleans is on this recommending list. Now, a lot of these schools aren't using this test for admissions decisions, and so you need to ask with the individuals, that school, hey, are you guys using this to decide if I'm getting in, or are you just like going to see if after I get in, did it line up with my profile? So, but just know it's recommended, not required as of now, but it's recommended for the LSU New Orleans. There's a few other close ones. UAB is obviously a popular one for our students to apply to down here. And, obviously a few other ones, Morehouse, ones that aren't too far, but any of these that you guys apply to, be aware, there. And then just want to talk about two other schools. Michigan State and Rutgers say one or the other. So they say you have to take CASPER or PREview. Just send one of those to us, and we're happy. But for the most part, it's pretty split down the middle that you either need to do one or the other for schools. And so you will either have to take 0 of these, 1 or 2. So as you look at your school list, decide there what's going on. Anyway, this test, as I mentioned, it's not free response. So the Casper, you're typing in or you're saying into a video, this is what I would do. This one, I'm going to pull up a sample question here that I have, and that's interesting way they do it here, right? You have to rate these decisions you would make in this situation, right? Of effective or very effective, ineffective, very ineffective. And so this is just a sample they give on their website as an example of something you might face, that this volunteer opportunity at a well-regarded clinic. You receive your schedule and realize that this volunteer opportunity conflicts with your required lab, and that's the only time the lab is being offered. So you're not able to make up the lab. And so you have these 5 different situations, or 5 different, responses to the situation. You could choose to skip the lab. You could ask your instructor to identify a solution for both. You could, just decide to not do the volunteer opportunity. You could tell them you're going to miss in advance. And you could also attend the lab and then investigate if, there's other options. And so there you might say, hey, it's not showing us the right answer here, but we often would assume, skipping your lab probably wouldn't be the very effective strategy there. And then at the same time, asking a solution that's probably not going to be very ineffective. It's typically going to be more on this more effective side. So you get the point there. They got a few other samples on here, but the idea is you want to be familiar with this, and you want to, know, okay, do I have the money to pay for this test? Is it required at the schools? Am I prepared to take it? Am I taking it early enough? And, typically as the timeline goes, you hear Mr. Bowen and I say you really need to be focused on taking the MCAT at least by, if possible, by May, right before you apply, to have it released in time. You can do it up until September for the MCAT. Then we typically say you typically want to apply in June to med school. And obviously you can do it up until November sometimes, but June, and then this comes right after. We usually would say, hey, you want to typically try to take these judgment tests by July, maybe August at latest. You could do later dates. So it kind of goes in that way. MCAT application, judgment test. You want to get all these ones in so that nothing delays your application, and so that you are meeting all the minimum requirements for every school that you're applying to. So that's what I had to say there. But Mr. Bone, you had anything else you wanted to mention?
Yeah. So we mentioned, we said there's a right or a wrong answer on this test as opposed to the Casper. So how this test was developed, it was tested first on doctors. They used doctors to kind of develop the validity and this reliability of this exam. So in terms of right and wrong, it's how well does the response that you chose match the typical decision making of other physicians in the field. And it kind of has to do with, doctors are called upon to make split-second decisions with the information that's available to them. They don't have the full story. They don't know the whole thing. Based on what information I have, this is the decision that I would make. And so what this test is trying to decide is how closely does your decision or the decisions that you make match, what a typical a doctor would do. Um, and so that's, when we say right and wrong, that's sort of what we're talking about, because you may say that is not the right answer, but it's the right answer for how a doctor would make a decision.
Yeah, great. So I did just want to say for this time, this could change, but we did reach out to LSU New Orleans and ask, will the preview be used for deciding of you getting in this year? As of this summer, they told us, no, it's not going to be part of the decision of you getting in. But as we said, this is a developing test. It's going to be maybe changing questions over the years, formats. It's going to be having new schools that require it. They're going to start using this even more and more for decisions. But so the preview is used less for decision making for getting in right now because it's newer. The Casper definitely has been around long enough that schools are using this. But one thing I wanted to mention, if you get a bad Casper score, or you get that preview score you're not excited about, we want to say this is one data point. So if everything looks great about your application, you just have this low score, we're not as worried then if you, let's say you have, something on your criminal record and you also said something that was very judgmental in your personal statement. And on top of that, you had this third low score in here, then it may hurt you. Or vice versa. Maybe you said something that seemed a little judgmental in your personal statement. They were unsure if it was judgmental or not, but then you did great on this test. They might not give you the benefit of the doubt. So it is one data point. So don't overthink it and stress out. It also could be an advantage if you do well on it. But just know that you might have to do it. And we just, encourage you to do your own research. Don't just watch this video, but hopefully this got you started.
And as Matt said earlier, when it's your turn to apply your cycle of application, you're going to want to go and check, because there are 8 schools right now using preview. Probably next year it's going to be 12, or whatever. And so you want to make sure that what is going on during the cycle that you are submitting your application.
Great. So we're out of time, but just encourage you guys, if you have more specific individual questions, you can come, go on Navigate and schedule an appointment with Robbie or I. You can send us an email. Of course, you can reach out to Casper, or you can reach out to AAMC about the preview exam. But just wanted to give you guys a little introduction to these SJTs. We did just want to say, too, if you didn't catch the other episodes, definitely look back on those. If you have any ideas for episodes or questions about our future episodes, reach out to us as well. But looking forward to the next one. We're planning on doing one on interviewing for medical dental school. And so anyway, we're signing off, but thanks again for joining us.
Thank you for joining us.